Is the Tailored Activity Program a cost-effective intervention for dementia care in Australia? Dementia can interfere with normal life for the person with dementia and their caregivers by impacting cognition, function, and behavior. The number of people living with dementia worldwide in 2019 was estimated at 57 million and is projected to increase to 153 million by 2050. In Australia, it is the second leading cause of death, and 1 in every 10 Australian people who are older than 65 live with dementia. Non-pharmacological interventions like exercise and occupational therapy, including the evidence-based Tailored Activity Program, can delay functional decline, enhance independence, reduce behavioral symptoms, and be more cost-effective for individuals with dementia living in the community. TAP provides a systematic approach to identifying and developing activities that match interests and capabilities of people with dementia and instructing caregivers in their use, while also providing dementia education and stress reduction techniques. The program spans 4 or more months with up to 8 sessions, targeting person-caregiver dyads and offering multiple benefits. Existing literature has shown that TAP can reduce behavioral symptoms and at the same time improve caregiver well-being. However, there are few studies applying decision models which can capture the long-term economic impacts of non-pharmacological interventions on people with dementia. Contributing to this emerging literature, our research examines the cost-effectiveness of the TAP program, given the limited findings in both international and Australian contexts. Measuring cost-effectiveness is multifactored. We use a Markov model to estimate cost utility and provide an incremental cost per additional utility gained. This measure is often compared to a threshold, knowing at the willingness to pay threshold at a public level of 50,000 Australian dollars. The model assumes 4 stages of diseases, from mild to severe and imminent end of life. We find that first, TAP is cost-effective for both males and females with dementia and their caregivers. Second, this occupational therapy-based program is likely to be more cost-effective for people with dementia from 50 to 70 years old rather than older groups, indicating benefits from early access to the intervention. Third, the number of caregiver hours can decrease by up to 200 hours over the person's dementia condition. We conclude with policy implications for health system planners, care providers, and those designing non-pharmacological dementia interventions. Our findings of TAP being a cost-effective intervention in dementia care provides evidence for policymakers towards improving health service design, making decisions on resource allocation and delivering high-quality care. To find out more, please contact the authors, who acknowledge gratefully that this work was supported by the National Health and Medical Research Council Boosting Dementia Grant.